Hi, this is Dr. Rob Rozbruch from Hospital for Special Surgery. Emily, my patient, sent me her recipe for stoma care after osseointegration amputation surgery. And I wanted to share it because I think that patients know best. And while there isn't one specific recipe, this has worked well for Emily. In sharing her stoma care recipe, I thought I'd give you a little bit of perspective on her story as well. So she sent me this recipe by email and I copied it down, but I'm going to expand on this and make it a little bit easier for you to see. This is Emily pre-op. She was in a terrible accident and lost her right femur at a very, very high level. She had real difficulty with any type of socket wear, as you would expect with such a short residual limb. She had some previous reconstructive surgery to try to optimize the length of that segment at another institution. We had a plan for osseointegration surgery, and we got a CAT scan and developed a custom-made osseointegration implant that would fit her residual limb. These are some pictures from surgery. I removed the screws but left the plate because I didn't want to compromise the integrity of the bone. And you can see this is a reamer creating the path. And this is what the custom-made implant actually looks like. This is the implant itself, which was 80 millimeters in length. And then these are the dual cones, and that's what attaches the implant through the stoma. So this is the impaction of the implant into the bone, and this is when it is finally seated in the femur. This is what it looks like several weeks later, and this is Emily's residual limb with the stoma. And at this point, you can see there's a rubber footy placed on the bottom of the adapter, and that was done so we could start a gradual loading program. And that's what we do for several weeks to gradually get the bone stronger, get it accustomed to the gradual load, and allow for time for the bone to grow into the titanium porous coated implant. This is Emily at 3 months, and on the day that she got her limb, and pictured here is with our prosthetist Harris. And you can see this is that day at 3 months, 12 weeks. She's after her single stage surgery, and she got her prosthetic leg attached and started walking with 2 crutches. Well, Emily made a lot of quick progress and has really been super energetic and super inspirational to a lot of people. You can see here she sent some pictures after she had done some serious hiking and climbed a big peak in the Adirondacks. So again, getting back to Emily's stoma care recipe, she uses an organic baby soap followed by Hibiclens, and she does that in the shower and washes it on a daily basis with a gauze pad. This is what the Hibiclens looks like. It's an antibacterial soap. And then after the shower, she wipes it down with a sterile gauze pad and some sterile saline. These are photos that she sent me. And then she uses a thin, round nursing pad with a hole cut in the middle and a little paper tape to form a cone on the implant. And she says that this allows my stoma to breathe, but also to have a layer of protection from germs. So this is the nursing pad, and this is what she does. She puts a little hole in it and then applies it in this kind of fashion with some tape. So that's Emily's story, and that's Emily's stoma recipe. More tips from Emily. I've made a natural spray with saline, with sterile distilled water and organic oregano oil for times that it looks a little off. And I haven't done an Epsom soak since before I had cellulitis earlier this year, but I know many patients do, and I will echo that patients do often enjoy soaking the stoma and the residual limb in an Epsom soak, not a full bathtub, but a separate container. Visit our websites to get a little bit more information, and I thank you for your attention.